Are you a high school baseball pitcher looking to improve your recovery and decrease soreness following an outing? I'm going to go over today one of the post-game mobility routines that I have pitchers do to help just with that for decreasing soreness and improving recovery following an outing. How do I know this? My name is Dr. Jeff Lewis. I'm the owner and physical therapist of Lewis Physical Therapy and Sports Rehab in Point Pleasant, New Jersey, where I have helped countless athletes get back to throwing pain-free, get stronger, and throw harder. Post-game routines, especially after an outing, are crucial because it's going to set up, like if you're a starter, what you do right after a game can potentially set up how you recover, especially for the days afterwards, but really for the rest of the week and how you get ready for your next start. A big part of that is mobility. Arm care, yes, there's definitely an arm care involved, but mobility is probably the big part that I want to focus on today that we want to make sure guys start doing after an outing. After an outing, you have very high intense effort. It's not uncommon to get sore and tight after that. So mobility post-game the goal of that is geared towards reducing those. So we want to focus on a couple areas. We want to focus on thoracic spine, shoulder, hips are really the big ones there. So that's what I'm going to show you guys today. So I generally use more static stretching for this. It just seems to help get a little bit better mobility stimulus and improving recovery. So first thing we're going to do from a shoulder standpoint, we're going to go ahead, we're going to grab a band. You can tie it around a pull-up bar. If you don't have a pull-up bar, you can use a door frame as well. You're going to hold that band, and you're really just going to sit back down into that, letting that band pull that shoulder blade up. You should get a nice stretch throughout that armpit here. If you're getting pinching in the front of the shoulder there, you're going too much of a shrug. You just want to let that band pull you up there. We're going to really just sink into this, let that band pull you up about 30, 45 seconds. Then I'm going to have you turn to the left. You should feel this now a little bit more along the side, maybe even towards the side of that shoulder blade in that rotator cuff area. Just working on just getting that shoulder blade, that scapula to upwardly rotate. And then you're going to come out of that. Again, you might hold each of those for about 45 seconds, just nice and easy, sinking into it. You don't want to go from 0 to 100% max stretch right away. You want to gradually ease into it, sync your breathing up. And then we're going to do some cross-body adduction, so we're working on that rotator cuff and posterior capsule. So I don't want my arm to be totally pulled across like this. If you're doing that and you feel this stretch more towards the back here, you're probably getting too much shoulder blade movement. So you just want to have it tacked down a little bit, but not aggressively pulled back, just so you're getting some separation. Like you should feel this along the side of that shoulder. You're not shrugged up here, that shoulder blade's down, and you're just, again, letting that band just pull you towards it while you're leaning away from it a little bit. And again, it should be intense but not uncomfortable. You can go staggered stance and gradually step away a little bit, like so, and then you relax. So that's a couple of shoulder mobility things I like to do. Now, moving on to a thoracic spine, we're going to now go ahead. If you have a dowel like so, that's great. You can use that. But we're just going to go into some extension. So you are going to have a bench right here in front of you like so. You can have a dowel held in front of you, and your focus, you're going to be sitting on your heels, is not necessarily a shoulder mobility. It's more of just dropping into that. You can just see my mid-back starting to drop into that extension. Again, I'm not totally down here. I'm just nice and easy, letting that mid-back slowly come down to the ground, creating a little bit of an arch in that mid-back versus a flexed, rounded position. And we're going to hold that for some time. Again, you might, if you're tight in your shoulder, you might get a little bit of a stretch in the armpit, but this is predominantly for that thoracic spine getting extension, which is crucial from a arm health and throwing mechanics standpoint. Okay, so that's that one. Now moving on to the hips, you can use a pad for your knee if you need to, or a towel or something, a pad like this. You are then going to have one knee down on the ground. Your other foot's behind you. And we're now just working on just that hip extension, so keeping that mobility throughout that hip flexor quad muscle on the front here. Slightly squeeze that glute, like 20 to 30%, nothing crazy. You're not arching the back, keeping everything relatively hollow, not super crunch forward. And then from there, you can do one of two things. You can move a little bit further forward, or you can move a little bit further back like this. Like when I move back, I feel a lot more along that quad there. And if you're able to reach back, you can have that for a little bit of support, or you can use a dowel like this to hold still. And you're just going to hang out there. Again, same thing, like 60 to 90 seconds on each side here. Just nice and easy moving through it like so. Okay. Now, last one we're going to do is a frog stretch for the groin, and the last one for the hip here. So we're going to go ahead. We're going to have our knees out to the side. I don't like having my feet out like this. I like having them relatively tucked in. Like for me, it's a little more comfortable for my hips. And then I'm just really just sitting down onto my heels. I might even shift a little bit side to side to feel a little bit more of a stretch in that groin on each side. And I'm just hanging out here for about 60 to 90 seconds. You can come down onto your forearms if you want a little bit more of a deeper, more aggressive stretch for that groin there. So the last thing we're going to do now is a little bit more for the low back and the glute. So we're going to go ahead. We're going to lie on our side here. We're going to have one arm out to the side. That top leg is pulled over, and your other arm is really just staying along the side. We want to try to keep that back shoulder on the ground as much as possible while we're pulling that other leg across. We're going to get a little bit of some distraction at that lower back and that glute. Nice and easy, pulling into that. Sinking up those deep breaths and getting a little bit more of a stretch each time. Again, same thing. We're going to go about 60 to 90 seconds on each side. So that's a pretty quick mobility routine that I will have pitchers do following an outing to help with just general body mobility, decreasing soreness, and making sure their mobility stays intact following one outing or repetitive outings. It should take you no more than 5 to 8 minutes. You do about a minute each movement, a minute each movement each side, so probably closer to 10 minutes, but it shouldn't take you anything more than that. And it's all about getting that heart rate down too. Like you're obviously after an outing, you're pretty wound up, so we want to try to just get that nervous system and body to just calm down, really to give it that cool down, that effect that we're looking for. So if you're a baseball player looking to take your post-game mobility routine to the next level and you have questions how to do so, go ahead and you can leave a comment below in the a question below in the comment section, or you can text us directly at the number below and we'll get back to you with a personalized plan.